The guidelines for effective delegation can be summarized using the 5 R's. The delegation or assignment must be the right task given under the right circumstances to the right person using the right instructions. And the person delegating must also provide the right supervision and evaluation. The nurse must determine the right tasks for delegation to assistive personnel. It is important to remember that the registered nurse may never delegate any portion of the nursing process that depends on his or her professional judgment. For example, the assessment of a patient, developing and evaluating the nursing plan of care for the patient, and interpreting and analyzing data are the responsibility of the registered nurse and cannot be delegated because they require the nurse's knowledge, expertise, and judgment.
How is her temperature doing?
To ensure the right circumstances, the nurse must always take into account the patient's condition, the setting, and the available resources when delegating any task.
Her temperature is 99. Heart rate is 60.
When dealing with a critical patient, the nurse should not be assigning duties that she or he should be assessing themselves. Of course, when selecting a person to delegate to, the nurse must take into account the knowledge and skill level of that individual. And once a task is delegated to an unlicensed person, that person may not subdelegate the task to someone else. The delegated task must be clearly described, including all the details about what, when, and why. Delegation does not end a nurse's responsibility. The person delegating must either supervise the task or assure that supervision is available. If necessary, the registered nurse must teach the skill being delegated to the person and supervise the performance of the task. There can be no delegation unless there is an appropriate level of supervision. Supervision means initial and ongoing direction, including direct observation if necessary, and the nurse must remain available for procedural guidance and evaluation of the task. Remember, it is negligence on the part of the nurse if the nurse fails to delegate or supervise properly.
Call the doctor. I need to have help in here right now.
In some states, the nurse also may be found legally responsible for any harm to the patient that results.